Okay, it is 12:30 now here on a Wednesday. Hello, BD.
Yeah, I'm glad you say that because it feels like Tuesday to me.
Oh, I know. You were off Monday. So
Yes.
yeah.
It's all messed up.
It's all messed up. We've got Dr. April Ritz with
Oh.
Effingham Pelvic Health and Wellness joining us on the show today.
Hello.
Hello, how are you?
Doing great. How are you guys?
Doing great. We're on
Good.
Facebook Live as well. You can see her. And so
Ah.
we're going to talk about a lot of different things today. But first
Yes.
off, what's some common conditions you've been treating lately?
Yes. So our clinic, we treat men, women, and children with any pelvic floor issues, as most of you guys know.
Yep.
So urinary, bowel, pelvic pain, abdominal pain, back pain. So we've had I've been seeing patients pretty much since Dr. Kyla has been gone. She just came back this week from maternity leave. So we have
okay.
all three of us are seeing patients now, Dr. Katie, Dr. Kyla, and myself. So my schedule, I will make it start slowing down a little bit. But I've just been seeing patients all day, Monday, Tuesdays, and Wednesdays, and then part of the day on Thursday as well. But just some common things that we've had recently. I had a patient who had a hysterectomy, hoping it was going to take care of all of her abdominal pelvic pain symptoms, right leg pain. But after the hysterectomy, which was earlier this year, she's still unable to have sexual intimacy due to pain with her husband, and she's still having quite a bit of abdominal pain. So we're working on that.
Okay.
Another patient who had endometriosis and had a hysterectomy, now dealing with urge leakage. So a lot of people, I had another patient this week who I said, when do you get your urge? Let me just guess. Is it when you're trying to get into your house from the garage? And she's like, you've got it. She goes, my dogs know that as soon as I open that door, they need to get out of the way because I'm going to the bathroom.
Yeah.
Dogs are smart.
Yes. And then also a patient dealing with some pelvic heaviness from bladder prolapse. I have several pediatric patients, a lot of them dealing with constipation, some recurrent UTIs, bedwetting. I had another young mom with I have a lot of endometriosis patients right now. Another young mom with endometriosis and significant abdominal and back pain and pain after intercourse. And we are already seeing some improvements with her, which is great.
Good.
Several adult patients with constipation. I have one that I'm working with right now that I had a rectal prolapse repair and doing rehab after that. And then, of course, we always have a lot of pregnant and postpartum moms in our clinic as well.
Sure.
The most common complaints we see for postpartum moms is back pain, pain with intercourse, and then sometimes urinary leakage and pelvic heaviness too.
Okay.
So
very good.
That's a wide variety.
That is.
Wow. Yeah, I like the variety.
Yeah.
Yeah. And a lot of endometriosis patients right now, like you said.
Yes, a lot of our patients, we are getting some pretty complex patients too, because we actually just had a patient call us, and I explained that imaging, so MRI, CT scans, X-rays are not going to show issues in this area if it's just a musculoskeletal issue. So a lot of the patients we see have seen multiple gynecologists, urologists, different providers, and they're just not getting the help that they need. And they're like, well, my imaging is always coming back negative too, or my urinalysis is coming back negative, whatever it may be. And like, well, that is definitely musculoskeletal then, and that's what we treat in our clinic. So if imaging is negative and you're feeling the pain is there, but muscles don't show on imaging if it's just like a tightness in the muscle.
Yeah.
Okay. Very good.
Yeah.
Now let's talk a little bit about menopause.
Yes.
That's the big topic.
That's
So
a
let's
big
talk about
topic.
yes.
Yeah.
So I wanted to talk about menopause because we have our upcoming class called The Change, Perimenopause and Menopause, coming up October 24th.
Okay.
It is a Thursday night from 5:30 to 7:30, and this time it's going to be at Casey Coffee Company.
Okay.
So Tiffany Mosley, she's a midwife and APRN, and she does women's health and hormone care. Her and I co-teach this class, and I talk more about the genitourinary symptoms of menopause, some of the ways we can help manage menopause better through exercise and stress reduction and sleep. But in our clinic, what we really focus on for menopause is called the genitourinary symptoms of menopause, or GSM. So if we think about genital symptoms that come with menopause, and for those that are listening, menopause typically for women comes around the age of 50. And the true definition is once you have not had a period for a full year.
Oh, okay.
It's technically when you're considered in menopause.
Okay.
Some women get through this transition with no symptoms and do very well. A lot of women have some symptoms, whether it's hot flashes, insomnia, or these GSMs. So the genital symptoms of menopause could be dryness, burning, itching, irritation, or bleeding in like the vulvar vaginal area for women.
Mm-hmm.
The urinary symptoms that can come with menopause can be pain with urination, increased frequency, which means you're peeing more than every 2 to 4 hours.
Mm-hmm.
Urgency, meaning you can't hold it and get to the bathroom in time, like you have to really rush,
Mm-hmm.
and recurrent urinary infections.
Okay.
And then the S for genital urinary symptoms is actually stands for sexual symptoms. So pain with intercourse and other sexual dysfunctions. So all those GSM symptoms that come with menopause, our clinic treats all of those symptoms.
Okay.
So gold standard now for these symptoms in menopause for women is pelvic floor physical therapy plus a vaginal estrogen cream.
Okay.
Okay. Not everybody's comfortable with these estrogen creams, but typically vaginal estrogen creams stay local to that tissue so they don't really go systemic.
Mm-hmm.
And I can't prescribe. So that's something I'm always calling their provider and discussing with them. Do you think this is appropriate for the patient?
Oh.
But most of my patients, I am recommending doing that estrogen cream because that pelvic floor has estrogen receptors. And once we get in menopause, that estrogen drops significantly.
Mm-hmm.
It can lead to more dryness, thinning of the tissue, atrophy of the tissue. So doing estrogen plus the pelvic floor physical therapy to help with all the symptoms and actually addressing the muscles, and we can help increase blood flow to that area. That's gold standard for
Okay.
menopause, going through these issues.
Okay. Very good.
Yes.
And I guess physical therapy, like you said, depends on what you're dealing with. I guess the symptoms.
Yeah. So every patient's different. So depending on for any condition, two people might come to us both for pelvic pain. But we do our exam and it's all different issues that are contributing to it. So we don't treat people, it's not a cookie cutter approach. Everybody's
Yeah.
super individualized.
Mm-hmm.
So if they're having urinary urgency, of course, we're going to address the bladder issues like bladder irritants. We're going to teach them urge suppression techniques and how to retrain their bladder. If they're having constipation always makes all pelvic floor issues worse.
Yeah.
So we'll help them address that and eliminate the constipation. There is a so if you go to a urology office, sometimes they will take a needle and put it into a nerve actually down by your ankle.
Wow.
And research shows you don't have to go to the office and actually get that done. I teach people there's a machine you can buy at home for $35. I teach patients how to get this machine on their own. I show them, give them the exact parameters. They go home and set this up and they do it to themselves once a week for 12 weeks. And it helps with urgency.
Wow.
Like acupuncture type of thing?
So it affects so it's not going directly into the nerve.
Oh.
What we do is the needle the urology does. But research actually shows, and this way you don't have to worry about needles either for people who are afraid of needles. You
Yeah.
just use like electrodes.
Okay.
And you put that over that direct area of the same nerve.
Uh-huh.
And it stimulates that nerve. That nerve is a tibial nerve. It comes up, connects to your sciatic nerve, which also has nerve branches to your bladder.
Oh, okay.
So by just hooking this up, a lot of my patients with urgency, we'll do this with them just once a week at home. It's a super easy treatment, $35.
Huh.
And they can get some good relief with that. Of course, it's multifactorial urgency, so that's not going to fix the whole thing, but that is one thing that we can easily get patients to be doing at home and not spending hundreds of dollars on one visit into an office and having to sit there
Yeah.
and do
Right.
that.
Yeah.
So that's called TTNS. And then a lot of times what we're also working on with these women is reducing tension in the pelvic floor muscles, which can help with like reducing pain, helping reduce recurrent UTIs, urgency, and then pain with intercourse.
Okay.
So we do a lot of hands-on work with the abdomen, the hips, the pelvic floor. And yeah, just every patient's going to be different what we're giving them to do in
Very
the clinic.
good. Very good. You mentioned that class earlier. Tell us
Yes.
again about that class.
Yeah, so the class is coming up Thursday, October 24th, and I think it's almost full. We have it open for, there's 28 seats that they can hold in the room at Casey Coffee Company. But class is October 24th, 5:30 to 7:30. It is $25 to register.
Okay.
I think there's people coming from our area that are just carpooling with some friends and going and going to get some coffee and just listen to Tiffany and I talk. But it should be a great class to really walk away and have a better understanding of this because women just don't know a whole lot about like period health in general,
Mm-hmm.
menopause health. They just rely on providers to tell them everything. But this way, we're providing information to them. Here's some questions you should be asking, some red flags to watch out for.
Mm-hmm.
So that yeah, that'll be a great class. They can go to our Facebook page, Effingham Pelvic Health, or call our office to register for that class. And I also want to give one last shout out. We have a mention this upcoming Saturday, we have a pregnancy and postpartum class.
Okay.
I do this 2 to 3 times a year. This will be the last time before next, like probably February, March. It is coming up this Saturday, October 12th. It is from 8 a.m. to noon. So if you are pregnant and hoping for like a vaginal delivery or going for a VBAC or even considering a home birth, this is a great class, whether it's your first child, second, or third. It's all the things that you're not taught. So pushing positions, what's best for our bodies, breathing mechanisms, and we get the husbands or partners involved, and they're
Mm-hmm.
actually we bring in yoga balls, we bring in our mats, we bring in towels, and we all have to practice and do acupressure points with each other for pain management. So that class is coming up this Saturday, and that class is $200 per mom and her support person, whoever that
Okay.
may be.
Okay. Very good.
Is that at your main location?
No, we can't fit it. We can't fit everybody in there.
Oh.
So we actually do this one at Sacred Heart
Oh.
Church in their parish center.
Okay.
So we have the whole space to
Yeah.
be moving around. So that, yeah. But people can call our office 217-705-5077 to register for either of those classes. Or go to our Facebook page and the links are underneath the events.
All right. Very good. Well, Dr. April Ritz, thanks for joining us
Yeah.
today.
Yeah, thank you guys. Give our office a call if you're having issues.
All right. And again, Effingham Pelvic Health and Wellness, give them a call and they can help you out.
Right on.
Yeah. Well, BD, just a reminder, everyone, there's ball games on both stations today.
Yes. Mm-hmm.
And that means no drive home. So no